If you struggle to sleep at night because of aches and pains in your leg, maybe restless leg syndrome, I think a lot of us deal with that, you're going to love our next conversation. Dr. James Gooden is here with Milligan Vein, and he's offering not only a better understanding of why that's happening to you, but some helpful ideas as well. So good to see you.
No, thanks for having me back.
Okay, so I'll use me.
Okay.
I have hit that stage where I have to kind of often sprawl out, like my leg will hurt at the back of my knee.
Right.
Does that sound familiar?
It does sound familiar.
What is it?
Well, it could be the effects of vein disease, and I'll tell you what we hear from our patients is that sleep quality has gotten worse over time. They've noticed that while they have tired, sort of heavy, swollen legs during the day, at night they can have restlessness, get kept awake by Charlie horses and cramps and that sort of thing, and have to get up and walk around. Find yourself sort of massaging your calves, at night in an attempt to get comfortable.
Right.
And then it may be vein disease, and it's not something that you have to live with.
Some degree of that, like cramps in your leg at night and that kind of thing, it's just normal. Dehydration can cause that.
Of course.
If it's chronic, is that the concern? Is that when you know?
Yeah, if it sort of has this overwhelming sort of hold on your ability to get a good night's sleep, it's something that you should probably get checked out.
Does it happen to people at a certain age, or can it, I would think pregnancy would be something that would impact this.
Well, pregnancy is definitely a risk factor for vein disease. Aside from that, of course, as we get older, we tend to see more patients coming in with vein disease. By the time we're 60, I think at least a third of us has suffered vein disease in one form or another.
So I think vein disease, first of all, can it look different to different people?
Absolutely. I mean, we've all seen sort of the classics, spider veins, varicose veins, and that sort of thing, but the majority of our patients just suffer from that, just tired, swollen, heavy legs, and quite frequently some type of disturbance when it comes to getting a good night's sleep plays into that as well. Do
you kind of end up having insult to injury, because if your legs are tired and heavy feeling, then probably your interest in exercising is diminished? But does exercise benefit the problem?
Exercise does benefit the problem, and I mean, one of the reasons why we kind of get cramps and restless legs associated with vein disease is that our muscles in our legs are an important part of sort of driving that blood flow out of the legs. And so when we've been on our, especially when we've been on our feet or sort of in a sort of sedentary sort of state for long periods of time, we tend to feel that. And at night, sometimes, that the crampiness or the restlessness in our legs is sort of our body's response to that, and trying to sort of do what it can to at that time to improve the circulation.
Is that word sedentary really important? Because if you're on your feet, as you say a lot, if you're on your feet and you're walking, is that different than if you're on your feet and you're standing in one place?
Well, it is, and like I said, just engaging those muscles in our legs is an important part of the venous circulation.
Right.
And so, if you're just standing there, you have all the effects of gravity working on your venous blood flow, but you're not really giving the system that sort of drive, that sort of pumping mechanism that our muscles give us.
Right. Okay. So now let's talk about what it is that you do at Milligan Vein. So somebody's watching and they say, "Yeah, that sounds like me. My legs are really heavy." And what do they do when they come to you?
Well, the first thing is just that, realizing that it's not something you have to live with, and that there's a solution. So just give us a call, come in and see me. Workup is very simple. We'd be happy to take care of you and get you moving on.
It's a day of procedure?
It is not. No, there's a process. It is a process involved, and so everybody is sort of affected differently. And so we start with a workup. First you come in and see me, and I do an exam, and we kind of decide that it does look like you have vein disease, and then we move on to the next step, which involves an ultrasound, which is a really simple test. So once I have the information from your ultrasound, and that helps me sort of tailor your treatment to your specific needs.
I think when I said day of treatment, I meant once you're going to go in there and do whatever you do to the vein. That's done in your office?
Everything is done in our office. Okay. Now, there is sort of a process, like I said, that we have to go through. These are medical treatments, and insurance companies, pay for that. But we do have to go through some steps, some non-operative management, where we do compression hose, a trial of that, and just you know, common sense things like elevating your legs at the end of the day.
Well, I think that's good to point out, though, because for anyone who does need the surgery, if you will, they want it, but you don't want to rush in.
That's
if
right.
something more conservative will help.
Of course.
Your office is in
We
Cleveland.
have an office in Cleveland, yep.
Okay, so he was brave enough to drive that corridor to come in our way. We were commenting on how tricky that can be when the fog is heavy.
It was tricky.
So you'll find him at Milligan Vein, Dr. James Gooden, 961-5682. Once they get in and they have the work done, the relief comes pretty quickly.
Oh, almost, you know, the majority of our patients are feeling some element of improvement within the first 48 hours of their first procedure.
MilliganVein.com.